All right, Jess Steier, you're in the hot seat this time. We had a conversation over on your podcast in the last couple of weeks, and I thought we need to have you on this podcast to ask you some of the questions. So appreciate you joining us here on the Mo News Pod.
Thank you so much. You already know I'm a huge fan. Thrilled to be here.
So talk to me about your story to kind of set the table for folks. Your background, you're a doctor of public health, how the Unbiased Science Pod came to be, and where it is today.
Yeah, so you just said it. I'm a doctor of public health. My journey to getting my doctor of public health was an interesting one. I, like so many, I was on the pre-med track at Stony Brook. Everyone there is pre-med at that university.
So you were going to become a doctor. You were going to become a doctor. Okay.
Yep. Thought I wanted to do clinical medicine, but then I did some internships at hospitals, and I realized I'm far too squeamish for the clinical stuff. Thought about doing a PhD in biomed. Long story short, I landed on public health. Public health is a really cool combination of math and statistics, calculation of risk of certain outcomes, but then also healthcare. So it was like a perfect marriage for me. So I started a data science consultancy called Vital Statistics in 2017. Really cool stuff, basically using data to turn data into information. Did certain health programs, interventions, policies, did they improve health outcomes, right? Of course, all the things that we care about. Mm-hmm. But then COVID happened, and people had no clue how to make sense of science by headline and what the heck was going on. So my friends and family were like, Jessica, what's an odds ratio? What's a p-value? What do these things mean? Should I be nervous?
This sounds familiar, Jessica. I was getting the same questions.
I could imagine. And so that's when Unbiased Science was born. And, I didn't think anyone would tune in except for like my mom and her friends, but it turned into something bigger. So we have a weekly podcast, and we put out these infographics on a daily basis, and started out just COVID vaccines, but now it's a wide variety of health and science topics. It's definitely plateaued since that peak COVID when people had a ton of questions, but it does still continue to grow, and I'm just trying to keep people's interest in science alive.
Well, as we've noted here, parallel tracks, because I found myself during the height of COVID answering family and friend questions about the news and what was going on. And as we all sort of became armchair epidemiologists to try to get a sense of what was going on. And like you, was trying to just address friends and family on Instagram, and then found a whole audience of people who were also interested in getting their news and information in that way. So it's great to speak with someone who's sort of gone through the same trajectory these past few years. So you've been doing this now for a few years. What have you learned through the process?
Oh my gosh. That people have a lot of different opinions. There's literally, I don't think there's a single thing that anyone can say that someone won't disagree with. It could be the most, benign, vanilla statement, but someone will take issue with it. And so much of what I'm doing, I'm trying to be nonpartisan. I'm really trying to speak to everyone. But no matter what I say, how I frame messaging, there's always, pushback in some way. And I know that, I'm sure you experience.
Yeah, we've joked about this, that basically it's like the Middle East, Donald Trump, and public health are the topics that no matter what you say, it's very hard for people to see shades of gray sometimes.
Seriously, just so with the bird flu going on, H5N1, I'm sure you've seen that. I saw you actually some of your posts about this.
That they found in the dairy cows in the milk.
Exactly, yeah. So it was detected in dairy cows. So I did a post that I thought would be just totally innocuous on the importance of pasteurization and not drinking raw milk, which could increase your risk of exposure to the virus and all that good stuff. Did not go over well. A lot of people upset about it. In particular, I had a lot of vegans come out and say, well, we shouldn't be drinking milk, at all. And then
so the vegans are coming at you saying no milk at all.
Exactly. So it became an animal rights issue. And it was like, no, that's not the point of the post. There are people who are drinking milk regardless of, yes, of course, there are animal rights issues, but regardless of that, the large majority of the population does consume dairy, and they need to know that you should not be consuming raw milk, raw dairy.
But at the same time, you have some people who it's become trendy to drink non-pasteurized milk.
Oh, it's such a hot trend because there's this idea. Well, there are two big things I hear: that it's good for people who are lactose intolerant, and of course that's not true. There's still lactose in raw milk. Okay. And then two, it's more nutritious than pasteurized milk. And yes, pasteurization is the process of heating the milk. And of course, it's killing some of these pathogens, the bacteria, the viruses that could make us sick. And yes, I mean, there have been some studies that show it does decrease some of the nutrients, but not in any significant way. And so, of course, the benefits of raw milk are being way overstated. And yeah, that's what we're dealing with.
Some of the stuff that you discuss on your pod, you discuss on your social media account, is when you look at various statements, various assertions being made, various studies that are out there. And, some of the things that you talk about often is dosage. You're talking about what journals they're from, whether people or animals were studied. Can you take us through just your process? Because I think for many of us, even, those of us in the media who cover things, we see a study. A journal says X is bad for you. Y is good for you. X could kill you. But there's a lot there, and most, I would say 99% of people, are not reading the actual studies, which are often very dense, scientific, and sometimes pretty lengthy.
Yeah. And that's a really interesting point. And I feel like COVID has really changed things because now the public is consuming more scientific research than I think ever before. Yeah. That didn't really, like these things typically happen behind the curtain of a peer review process when you have scientists really closely evaluating these studies, right? It's not intended for a public audience. So it's changed everything. But yeah, to your point, if you want to find a study that supports a particular claim or stance that something is very good or very bad for you, I promise you can find it. And what people don't understand is that PubMed, which is one of the main repositories of scientific studies, yes, you can find a study on PubMed. That does not mean that it's the end all be all of research, because PubMed is just that. It is a repository. So it's just a place where people can find studies, right?
Is there a rating service for studies?
I think there's some AI tools. I think there's one Consensus that might do that. But yeah, we're going in that direction. But at that point, so this is why you can't take any one study unless it's a huge landmark study with thousands of participants, an RCT, a randomized controlled trial or something like that. This is where we have to trust the scientific consensus and the body of research. And unfortunately, a lot of times people will say, oh no, that's just scientific and medical establishment. They're suppressing these one-off studies, these brave scientists.
Right. And in some cases, studies are sponsored by pharma companies, et cetera, with an agenda. Yeah.
Correct. And that's just a part of the drug process is like the companies that are developing these drugs, they have to do clinical trials, but that does not mean that the data still don't go through a very rigorous peer review process. And then we have all these surveillance systems in place, even once the drugs are released, like monitoring safety and effectiveness. There are so many systems in place for that. So just going back to your question, just a couple of low-hanging red flags. Yes, if there's only one study to support a claim, that's usually not great, especially if it's a preclinical study or an animal study. That's also not great.
Wait, Helen, explain what preclinical means.
Yeah, so preclinical, before it hits the market, before we've tested it, well, actually not even hits the market, before it's been tested in humans. So we have clinical trials. Those are studies done in humans, and preclinical is pre-human. And we can't even get to the clinical trial stage until we see some evidence that a drug or intervention is safe or that it might actually work. That's why we do those preclinical studies. It's like our first pass at understanding whether something is safe or it works. So we have these preclinical studies, but just because something happens in a rat or in a monkey or in some animal being studied, of course, that does not mean it's going to translate to humans. Yeah. The other thing is, take aspartame. And I think we might have talked about this on our episode. I can't remember.
So aspartame, that's used in a lot of diet colas and
correct. A non-nutritive sweetener.
Right. Non-sugar sweetener.
Yep. Non-nutritive sweetener. It's an artificial sweetener. Correct. So it's not table sugar. It's right. And so there have been a lot of headlines saying, oh, aspartame causes cancer.
Right.
And this is because the World Health Organization, or one agency within the World Health Organization, said there's the potential for it to be a carcinogen. Now, when you look at how those classifications are made in Europe and in other countries, they're looking at the potential for risk. Here it's something called a hazard-based approach. Here in the US, we take a risk-based approach, which really takes into account the likelihood of harm, the amount of exposure that we'll need to have to actually see harm. So, and tell me if I'm getting too deep in the weeds here, but so these studies, so in Europe, they said, okay, yes, there are some preclinical studies done in rats that showed that it can cause cancer. But again, they're just conducted in rats. And when you look at the levels of exposure, they're exposed to aspartame at like 5,000 times
right,
anything
it's like
that
the
we'd
equivalent
actually be
drinking
exposed to.
20 colas or 15 colas a day.
Exactly. So that's why we always say the dose makes the poison. You have to say, okay, can this potentially cause a negative outcome? Yes, but are we realistically going to be exposed to even, the bare minimum that we need to see any risk of these things? And that's where a lot of these headlines distort and cause a lot of fear.
Right. So just to clear this up for folks, you're not recommending that I drink a Diet Cola every single day. What you're saying is, the evidence that you've seen so far from a variety of studies have not shown the direct link that is sometimes implied in some of the headlines about these studies.
I love what you just said. You said at this time, and that's really important because we're always collecting new data and science is always evolving. So that's really important. I think that unfortunately people, and even sometimes in the science community, we're guilty of saying things so definitively, and we can't do that. But to your point, am I telling you should drink a Diet Coke every day? No, but if you're drinking that instead of a Coke or a sugar-sweetened beverage, you have to weigh the risks and benefits. I probably wouldn't recommend you having 20 cans of Diet Coke a day every single day for the rest of your life, right? So,
right, and there's certainly other health impacts beyond the aspartame connection that have been studied and shown to find some negative consequences.
For sure.
But just to kind of wrap this up in terms of how you read a study, what are the things people should look for? Like, are there certain bullet points that, like, when I see a headline, and actually, if I'm a curious person and I go to dig up that study, what are the things I should look for? Kind of top line things to get an understanding for what level of reliability I should give the study?
That's a great question. For starters, again, sorry if I'm sort of beating a dead horse. You want to see, like, is this the first study? Like, or are they citing other studies that sort of support this conclusion? Because consensus is important.
Right. And by the way, there's studies of studies. A study comes out and they didn't actually do anything themselves. They're just summarizing a bunch of studies, which is also what I learned about studies.
Yes, systematic reviews are fantastic, literature reviews. We're looking at the body of evidence. And there's different types of those where they can actually take the data and collect the data and then reanalyze. There's all kinds of fancy things that we could do. But that's one. Two, again, you want to look animals, humans, you want to look at sample size, and there's no like threshold. People are like, well, how many people have to be in a study? You can't answer that because it depends on the analytics that we do
right. Sometimes I see studies with like 30 people.
Exactly. Typically those smaller, so like if it's fewer than 100 people, it's very difficult when you have that small of a sample to achieve statistical power, especially because a good study is going to control for something called a confounder, which are third variables that are associated with our whatever it is we're studying and the outcome of interest. So it's like clouding the effect of, the association between the two things. And so a good study is going to control for a lot of those confounding variables. And from a data science perspective, you need a large sample size because every time you're controlling for something, you're kind of cutting the data up, if that makes any sense. So we need a larger sample. The other important thing to remember is there's something called external validity, and that's just a fancy way of saying generalizability. So does the study population look like the general population? Because if it doesn't, we can't extrapolate, right? So if it's a study done in only, 30 white men living in Arkansas, we certainly can't extrapolate that to, to women, to other age groups, to other locations, geographies. There's so many other factors, that could be impacting those outcomes.
Yeah, it's something I tell people when they ask about polling, political polling, for instance. That's also, data science. It turns out, by the way, there is sort of a magic number if you're doing it right in America, believe it or not, in a country of 350 million. If you get the right 1,200 to 1,300 people, you can actually get a very good statistical sample of how Americans feel about something, which people find shocking. They're like, I've never been called by a pollster. There's only 1,000 people in this poll. And I'm like,
yes,
well, within margin of error of plus or minus 2, it's actually pretty accurate. And so one thing I will tell folks, and it speaks to what you said about studies, which is sometimes a poll can be an outlier. But if you see 10 polls that are all showing something, then you can take an average of them and you have a pretty good indication of the direction of something.
100%. And to your point, if that one poll, let's say, is very well designed, and if I'm sure that I think you said, 1,100, 1,200 people, you're probably getting people from different demographics of different parts of the country, right? It comes down to that representation.
Yeah. Like, for example, right now, there's some new polling out that's showing that RFK Jr. is taking more votes from Trump than Biden, but until now, he's been taking more votes than Biden than Trump. So we don't know if these two new polls are outliers or early indications of where things are evolving as you and I speak here at the end of April. One thing that we've spoken about, you and I, is public distrust. And that's something I'm sure you saw evolve exponentially. I'm probably using exponentially wrongly here with the statistics person, but it's improved a lot. I mean, but it's increased a lot in the past couple of years. And that includes distrust for organizations like the FDA and the CDC. What you've been sitting at the front row here, taking in their information, watching how they've been communicating publicly. Give me a sense of your critique, Jess, the extent that you're comfortable, or your assessment of how they've done and why you think and how you think that's factored in to how the American people feel about organizations like them right now.
Yeah, it's no small feat. And I think they're really just right off the bat fighting an uphill battle. And I'm certainly, like, here I am sitting in my house able to criticize how they're doing it, but I'm not doing what they're doing, making decisions and communicating to the public. I think early on, first of all, there was a shift in CDC leadership, and we could talk about that in a second, but they were coming in and I don't think that they were doing a great job communicating sort of what we said early in the episode, that science is evolving. So, like, take the issue of masks. Early in the pandemic, they were saying, no, people don't need to go out and wear masks. And it's because we didn't have the data to support mask wearing. We were still learning about SARS-CoV-2, right? The virus that causes COVID and how it's transmitted. They were also dealing with practical implications of the public going out and buying masks when we needed to make sure that our frontline first responders had enough masks, as they were obviously in the highest risk.
Right, the shortage of masks at hospitals, and this
exactly.
They're sort of like, hey, public, hold off right now.
Exactly. So it's a mix of, yes, you're balancing the science, which is evolving, and then you're also battling like logistics and practical considerations like access and shortages and all that good stuff. I will say, so now the new head of the CDC is Dr. Mandy Cohen, and they recently put out, I don't know if you saw at this point, I don't know if it was like 4 months ago or something like that, the new guidelines for isolation when you're sick with COVID. When can you return to school and work? Yeah. And this was unbelievably controversial. A lot of people in the science world were very up in arms with the CDC because they basically said, look, if it's been 24 hours since you've had a fever, you can safely return to school or work. Now, if you look at the data, we know that you're probably still shedding virus, but you're likely out of that peak infectious period if it's been 24 hours since you're feverish. So then you're dealing with people like on all sides of the spectrum, right? You have the hardcore science people who are like, but look at the data, they're still shedding virus. And then you have the other people who are like, this is ridiculous. Like, I can't take off of work. I can't keep my kid home from school. So I actually think what they put out was a very balanced, practical guidance, which I was pleased about. But I do think that they might be able to do more in terms of like giving the context to the public when they put out these, like, why are we saying this, or what, I think the why. Yeah.
I mean, I think, you're talking to the early masking thing, and I think that's where, for a lot of people, they're to lose some trust, because there was a lack of transparency. They were citing, well, we don't have the science on this, but in essence, they were making a practicality argument. And then, we find out later that the 6 feet, separating 6 feet is sort of a made up thing. And so I think there was a frustration. There was an assumption that there was a lot more science there than sometimes meet the eye. But the way you explain it, and I think that they have been insufficient in explaining, is that what they're trying to balance is practicality and the science. But ultimately, we have to have a functioning society, and you can't run society like you run a hospital.
Exactly. Totally. And I mean, that's the nature of public health. It's not, I hate to say this, but it's not like a hard science, right? Like it really is where science meets the public. And so exactly that. I mean, we just have to be realistic. Like, we could tell people to mask or stay home till we're blue in the face, but will they do it? I mean, look, we have these vaccines that there are more eyes on these vaccines than anything that's ever been offered to the public. Mm-hmm. And yet we still have we have these agencies saying, get vaccinated. Vaccinations are going to prevent hospitalizations and death, but people won't do it. Right. And then on that note, if I could just expand, I think there's also maybe the CDC, now they're really emphasizing this, but there was this idea that the vaccines were intended to prevent transmission, right? If
Correct.
You get the vaccines, you're
and
not
I think that was
sick.
That was a key issue for them.
Correct.
Is they promised, not that they promised, but they talked up something that turned out not to be true.
But it was true early on. And this is the other piece that people who aren't steeped in the science aren't going to understand. This virus is evolving, and it's, we're seeing different strains, mutations of the virus, right? Early on, the vaccines actually were quite effective at preventing transmission, but then they mutated and they became less effective at transmission. That being said, the primary goal of vaccines from day one has always been to prevent severe illness, hospitalization, and death. Mm-hmm. There are new studies actually that have come out that show, while not the primary focus, the vaccines do somewhat reduce transmission, and it's because they reduce the viral load, they reduce the length the duration of illness. So in those ways, it's less likely that we'll transmit the virus to other people.
But I think one of the main issues they face is just this communication problem.
100%.
And and I think, by the way, they're not alone in this. You see this across the government, you see this across organizations, you see this from companies. Is that a certain message will get put out, the public will interpret it a certain way, and then no matter what you say, getting yourself out of that hole is very challenging.
I always say, and I always botch this expression, but once the horse has left the barn, or what is that? You know what I'm saying? It's very hard to put it back in. And so once people were like, oh, well, they lied to us. These vaccines are not preventing transmission. I know, my neighbor got the vaccine and she got COVID the following week. It's not this magic bullet, right? And I think some people feel like the CDC and other agencies sort of built it up to be this magical thing. Major issues with communication.
And one other thing that people often ask me about is when speaking to the trust or lack of trust they have in certain governmental agencies, is the power of lobbyists and corporations, whether it's big agriculture companies, whether it's big pharmaceutical companies, and the amount of money that they're spending to lobby Congress, change rules, et cetera. In your research and your experience, how much should that factor into how people interpret the declarations, the recommendations that they hear from these larger agencies?
Yeah, look, I'm not going to say that the FDA is this pristine agency, the FDA, CDC, or all these federal agencies are, pure of heart. Of course they're not,
There's no pure.
There's no pure of heart in any industry, agency, nothing, anywhere. So I would say, and certainly I think it was more common before regulations have been passed and laws have been passed that really put an end to that sort of, riffraff or, intermingling between industry and governmental agencies.
So there is still sort of a revolving door, you see where the former heads end up. And back and forth.
Yes,
Yeah.
I'm not going to argue that, but I would tell those people, I always say, okay, if you're willing to take a supplement though, like you're willing to take a supplement because you don't trust big pharma, so you'd rather take this all natural supplement than whatever you can get. That's also a multi-trillion-dollar industry, the supplement industry. And the difference between the supplement and the vaccine or the drug, the pharmaceutical, is that it's unregulated. So they're untethered by, the research and the safety and the efficacy. They don't need to show the data. So yes, is there some influence? I would, of course, there are influences. We're all, whatever, intermingling. But there is so much. I mean, I've dealt with and spoken with governmental agencies as well as industry, and oh my goodness, they're all terrified. Like, you have to be very careful. Everything has to be disclosed. There's a whole lot of transparency. Mm-hmm. And I would say, I don't think that that's happening on the other side for the things that the supplements and the wellness and all that stuff that people seem to have this blind trust for. I don't understand why they're held to a different standard.
Talk to me about organic, the good, the bad, the misnomers, where it actually, I won't say pays, but where it actually might be beneficial to pursue something that is organic versus something that is not. I know that it's a hot topic for you guys.
Yes. When I would only buy organic if I'm at the store and the organic produce looks better to me than the conventional produce. For me, there's no other real reason to buy organic over conventional. It's not cleaner. It's not healthier. It's not more nutritious. It's not inherently better for the environment. The truth of the matter is, first of all, people don't realize organic produce is still sprayed with pesticides. That, I'm telling you, will blow some of your listeners' minds. People don't realize that.
But what's the difference between the pesticides the organic fruits are getting versus the non?
That they're organic pesticides. So they tend to be, some people will say like better for the environment. They come from less like manufactured, less manufactured chemicals. But the thing is, they're also less effective. And so we need to use more of them on our produce. So again, there's a trade-off there, right?
Okay.
Yes. So organic produce is still sprayed with pesticides. Let's get that out of the way. The amount of pesticides that's present on our produce, whether it's organic or conventional, is so minimal. I'm talking trace residual amounts, and our bodies do a very good job of excreting any trace amounts. That's why when you do like urine tests, they'll show up as a byproduct, they're showing as being excreted in our urine. That means our bodies are doing what they're supposed to do. And if you're concerned, all you have to do is run your fruit or your veggies underneath the faucet. You don't need any special soaps and detergents. Some people like to use a vinegar solution. That's fine, but there's no nutritional benefit. And the thing that grinds my gears is, and I know this is what actually brought us together, was the Environmental Working Group, the EWG, puts out their dirty dozen list and scares the crap out of people that there's these, these dozen fruits and veggies that you have to avoid. Yeah. Oh my goodness. What's going to happen if you eat strawberries, the conventional strawberries? Nothing is going to happen if you eat conventional strawberries. And the fact of the matter is, especially Americans, we're not eating anywhere close to enough fruits and veggies. And then we know organic costs more. So then look at like the certain groups that we know in particular are not getting fruits and veggies, like lower socioeconomic status. Now we're scaring them and shaming them that conventional is bad or dirty or whatever. It's just, it's nonsense. It's fear mongering, and it's not based in science.
At the same time, though, looking at all these studies, there is a concern about putting pesticides into your body, these chemicals. No. Mm-hmm.
Dose makes the poison. Let's go back to that. So yes, especially you can certainly find a lot of preclinical studies that show pesticide exposure can lead to, cancer, infertility, whatever these outcomes are. And I'm just making that up. But again, we're talking about preclinical studies. We're talking about exposures that are even the people who are the farm workers, like industrial exposures to pesticides, are so much far lower than what's being studied. The studies are a worst case hypothetical scenario that is not, it's not the reality. Even in the most extreme situation, we're not going to be exposed to those levels. So again, could pesticides cause these things? Sure, but not at the levels to which we're exposed.
You had a op-ed piece recently in The Hill talking about the hazard-based approach to risk. Talk to me about that piece and the case that you've been making.
Yeah, it's so frustrating to me. I see so many influencers on social media, like what we're talking about, the dirty dozen, or don't eat this, don't drink Diet Coke, or don't eat, the latest was Cheerios because there's something called chlormequat.
And there's like glyphosate?
Glyphosate, pesticide. This goes back to the whole, and then GMOs. There was, people are scared of all these things. And I get it, especially if you don't have formal training in science. I understand, especially as a parent. I have 2 young kids. I want to make sure I'm giving them everything
they
can to be as healthy.
Too, so
exactly. Yeah. I get it. I really get it. But and these marketing campaigns, what these influencers put out, there's one guy, and I don't want to call out any names, but there's one guy in particular who stands out. He has no background in science, no formal scientific training, and he will run around the grocery store reading the backs of the ingredients and cereals and soaps and just everything that you use. Don't buy this. It's just fear mongering, and we're becoming this culture. We're scared of everything. And the reality is there are very few things in this world that if we consume them or put them on or in our bodies every once in a while, it's really not going to make that much of a difference to our health. I think we all want to feel like we have more control over our health than we actually do. And I'm not saying, of course, there are behaviors and patterns that will impact our health,
right?
But it's just, there are also so many other factors outside of our control, genetics, environmental fact. I mean, a million things. We're not, unfortunately, as in control of our health as we wish we would be.
Right. And I don't want anyone to get the wrong impression. It's not like you're saying, like, eat whatever you want, processed foods are good, like that. Ultimately, I guess the case that you make through your platforms is that just everyone take a deep breath.
Everyone take a deep breath, moderation. And I'm glad you brought up processed foods because I get asked about that constantly. Processed foods, ultra processed foods. You have some people who will point out that literally anything you buy at a grocery store is processed in some way. So people take issue with even the word processed. But obviously we're referring to things like, a bag of chips or whatever, the typically, and I'm using air quotes here, like unhealthy foods. Even those in moderation are unlikely to do any damage, like real damage to us. It's more about the patterns that we form. So if I'm, upset about something and I have a few Oreos, like I shouldn't feel terrible about that. And, it's more about the big picture. They shouldn't make up the majority of your diet, right? Mm-hmm. But every once in a while, like we take a very absolutist approach in this country. And I think that's very problematic. Nothing is black and white. It's all about the gray and the nuance. We shouldn't be terrified of every single thing that we're doing.
Yeah. One thing that I found notable is, and this is where actually, like, I appreciate some of what I hear from sort of the more holistic, organic side of things, is that, like, based on my experience and the doctors I've gone to, there's never been a real discussion of nutrition in any way, shape, or form, and the impact of the food that you're putting into your body on your health. That, the kind of traditional critique of Western medicine is that it's all about medicating to make things go away, and not really getting to the origin of things, et cetera. And I think part of what you see trend line here is people kind of trying to embrace taking a deeper look at the food you're putting into your body. So you ideally can prevent anything that, or help prevent things that eventually just are, typically you're giving some sort of antibiotic or some sort of medication to make it go away.
Yeah, I hear all the time that we have a sick care system and not a health care system, right?
No preventative care in a real way.
Correct. And I'm married to a physician. He's an ER doc. And I'll tell you right now, the way that the healthcare system is set up, it is designed so that the docs are seeing as many patients as possible. Even if someone like my husband, whose heart is so pure, he genuinely wants to help his patients, he gets chastised if he's spending too much time with his patients. Yeah. So I get why people are drawn to alternatives and to wellness. It's not a replacement, though, for medication. I'm not saying medication is always warranted, and there have been issues with like over prescription of antibiotics, for example, which is a huge issue in this country with antibiotic resistance and all that stuff. But that being said, like, you know, these alternative, like a lot of naturopathic practitioners will say, oh, you know, you just need to put, for example, like onions on your feet instead of taking antibiotics. And is that likely to be in and of itself harmful, putting onions on your feet? I mean, it might be stinky, but it's probably not going to harm you unless you're not taking an antibiotic if you have a bacterial infection. So it's not a replacement. I guess for me, like, there are a lot of people in the science world who will automatically poo-poo any and all of that stuff. Yeah. And even I've been guilty of that. I'm going to own up to that. But I'm really shifting my thinking. And I'm like, you have to understand why some people are drawn to that. There's also cultural stuff that, you know, impacts our attraction to things like that. But I do think it sets up a dichotomy with Western medicine. And I think more than like, instead it should be more like, maybe it could be complementary, like we're doing these things together, but it's certainly not a replacement for medication when medication is warranted.
So not an either or, but in some cases an all of the above, in depending.
Yes. In that same breath, though, I'll say that there are certain things that are recommended by some of these alternative practitioners and naturopaths that have the potential to be dangerous, like these IV medication drips, for example, which seem totally safe. I mean, we've seen people die from those. Even the supplements, when they're all natural or herbal, people are like, oh, these are safe. No, you can still have very dangerous drug interactions. I mean, there are all kinds of things. They're not innocuous. And I think people hear natural herbal and they assume it must be safe. And that's not true. And oftentimes those, well, almost always they're not tested. We know there are all kinds of issues with labels where the labels are inaccurate. You don't even know exactly what you're consuming. So no, the Western medical system, the healthcare system is not ideal, but I think people are a little too hard on it, to be honest with you.
How are you deciding what to dive into every week?
Yeah, so I'm a data scientist, so I'm sort of trained to look for trends. And so I'm very keenly tuned into the questions that I'm receiving, the links that people are sending me. You know, sometimes they're like nothing burgers and I'm not going to address them. But then things sometimes go viral and really get picked up in headlines or a TikTok viral video or something. But then there are also the evergreen topics that I think are very important for people to have certain foundational knowledge about. So it's sort of a mix of the evergreen, like foundational scientific concepts with, you know, the hot topics, what people are talking about, debunking misinformation and all that stuff.
What are the most popular things you're getting questions about right now?
Good question. I mean, right this second, lots of questions about the bird flu, lots of questions about measles. I still get questions constantly about the safety of the COVID vaccines.
What do you tell people about that?
The COVID vaccines?
Right, because we don't have long-term studies on them yet, right?
Well, sorry, I didn't want to interrupt if you...
No. I just throw it out there because, you know, there's a lot of skepticism about it, right? And then people are worried the fact that, like, the major companies have been given basically carte blanche, like there's no liability associated with it, has led to skepticism out there about the safety of the vaccines. And then there's been, you know, like I see it every time, Jess, every time somebody young dies, like the immediate comments come in there being like, were they vaccinated?
Yeah, I think even O.J. Simpson now, isn't this the late I saw?
But O.J. was like 76 and had cancer. Like,
it doesn't matter. He was vaccinated, so it must be the COVID vaccine, right?
Right.
Okay, so let me address the first thing. This is something I get all the time. We don't have long-term data. The reality is I can't tell you with certainty that what's going to happen to people who receive the COVID vaccine 30, 40 years from now. It's true. We don't have those data. However, we have over 3 decades of data on the mRNA technology. That's the basis for the vaccines. We now have 3.5 years, or however long it's been, of data on these vaccines. And we know from every vaccine that's ever been developed, if you're going to develop an adverse reaction, it's probably going to happen in the first week or so after you get the vaccine. And obviously we have a much longer period than that now to study. And we also have billions of data points. And from a data science perspective,
how many billion people got the mRNA vaccine? 2?
I think it's more than that. Honestly, I don't have the number off the top of my head. So it's really, we have a lot of data, and we have a lot of data on the technology, and we have decades of data on understanding of vaccines in general. So we know more than I think people think we have. Mm-hmm. And then also, what about the long-term effects of the virus, right? I mean, people, why aren't we talking about that?
Which we also only have 3.5 years of data on.
Exactly. And even within the 3.5 years, though, we do know that people are suffering from long COVID and, myocarditis, by the way, as a result of the virus, much more so than as a result of the vaccines. So again, we have to contextualize that everything we put in or on our bodies is going to come with some risk. I'm not going to tell you there's no risk, but
there's an inherent risk in getting a vaccine. There's also an inherent risk in not getting a vaccine.
Exactly. And I think, as a parent, maybe you'll appreciate this. I think people think, if I'm young and healthy, if I have a kid, it's really not an issue. This is an issue for old people. Certainly, we see the highest risk is in the 75 plus population. But do you know which age group follows the 75 plus as number one in hospitalization and poor outcomes?
I do
Any
not
guesses?
Know. No. But I think I know where you're going. Yeah. 0
to 6 months. Infants. Okay. We're seeing incredible levels of hospitalizations. And remember, this is the group that
when you say incredible levels, what are we talking about in terms of, are you talking about COVID 0 to 6 months?
The 0 to 6 month year old. So infants, These are kids who can't yet get vaccinated, right? Because the vaccines are only approved for 6+ months. This underscores the importance of getting vaccinated during pregnancy and passing on some of that immunity and protection to the infants when they're born, and certainly getting them the vaccine as soon as possible once they hit 6 months. Mm-hmm. Because again, people think kids' health, this is not an issue, but 0 to 6 months, this follows the 75 plus population. So we can't and we should not write off COVID. We're still seeing thousands of people die every month in the US alone from COVID, far worse outcomes than the flu. It affects every organ system. I mean, this is just something you don't want to mess around with. Yeah. So that's what I'd say.
Just since we're talking candidly here, one frustration I've had with the COVID numbers is that we never quite found a way to distinguish dying with COVID versus dying from COVID in the hospitals.
Yeah, there's this idea, and I heard this a lot, that we're messing with death certificates. And if someone has COVID, you're automatically writing the cause of death as COVID on the death certificate.
Right? You happen to be in the hospital for other causes, but because you happen to have COVID death, it also, there's a financial incentive for the hospitals to mark COVID as on the death certificate.
It's not a thing. It's not happening. Again, I'm married to a clinician, and I know that's just an anecdote, but it's not a thing. No one is falsifying these medical records, these death records. And the clinicians use their clinical judgment. Did COVID hasten a person's death? Would they have died if not for COVID? That's the question. And if the answer is no, then that person died from COVID. So, yeah.
Got it. Well, maybe an asterisk that this person happened to be really, really sick and was dealing with other stuff. And then, yes, COVID kind of set them over the edge. Right?
But when we do research, when we're looking at medical records, I think we have a lot of those data, right? When we're doing our analytics, we can control for, remember those confounders? We can control for things like other comorbidities and severe illnesses. So it's not like we're just writing all of these things off.
Got it. So what's next for Unbiased Science Pod and your platform? What should people be looking out for, and how can they follow you?
Oh, thank you so much. So you could, first of all, tune in to the Unbiased Science Podcast on any podcast platform. Follow along on social media at Unbiased Sci Pod on Instagram, Facebook, all the platforms. This is my life's passion. I never thought that communication would be my thing, right? I was a public health scientist, but I love this. And I think that the public really does need help discerning misinformation from good information. And so I'm hoping to grow the platform, grow the following, figure out a way to make this sustainable. I haven't cracked that nut yet.
We're all trying to figure it out, Jess. I'll let you know what I learn. You let me know what you learn.
Will do.
As we all evolve our COVID family and friend projects into growing businesses for everybody. I hear your dog's barking in the background. I don't know if that means they need a walk or a
I'm
lunch
muting
or
myself.
something.
I'm so sorry. I mentioned
it's
that I have
all
4 dogs.
It's all good. I think that's one of the more interesting things. You have 4 dogs at home. I read somewhere you were looking to adopt. Were you trying to adopt a pig? Yeah.
Yeah. I'm a crazy animal person. I'd have 100 dogs if I could. My husband would probably divorce me. I just love animals. I prefer them to people. If I'm being
4
totally
is the
honest.
threshold for your husband. He's like, I will not do more than 4.
But I'm getting ready to push him to 5. But if not,
wow.
goats and pigs are on the way. So yeah, sorry about the noise.
You're soon going to have enough for your own preclinical studies. Anyway, Jess, no, God forbid. No, these are your pets. You wouldn't touch them with anything.
Never.
Anyway, thanks for joining. And we'll have all your information in the show notes and look forward to continuing our conversations.
Thank you so much, Mosh. Take care.